Okay, so Elizabeth Warren unveiled her plan for universal childcare earlier on this week, and we're just going to do a full breakdown of that. Obviously, that's an issue that I think definitely does need to be addressed. Childcare costs in this country are far too high, but we'll get to exactly how high they are in a minute. I have a ton of numbers here for you, along with a full breakdown of the childcare plan right now, so just dig in with me, and we'll start going through this right away. So the plan would guarantee childcare from birth until the time children entered school, which would be 5 years old in terms of the K through 12. That would be when public school would be available to them. So it seeks to make access to childcare universal by offering federal funds to providers that offer care at their facilities on a sliding income scale. Families with incomes below 200% of the poverty line, around $50,000 a year for a family of four, would pay nothing. No family would have to spend more than 7% of its household income on childcare, no matter how many kids they have. So if you're below that, around $50,000 a year for a family of four, it's free. But if you're above that $50,000 mark for a family of four, you wouldn't have to pay more than 7% of your household income, but you still would have to pay. So that could be a possible problem with it, and I'll get to why that could be in a little bit. But let's continue with the facts of the situation first. Only childcare providers that meet federal safety, staffing, and curriculum standards could qualify for the funding. Sources familiar with the plan caution that some of these details were still in flux as of late last week. The campaign reportedly has an internal analysis that shows the initiative would likely require around $700 billion in new federal spending over 10 years. That number is a net figure taking into account the higher economic benefits of early childhood investments, such as making it easier for new parents to return to work. Her plan would also be at least 4 times what the federal government currently spends on its main early childhood programs, which include Head Start, a block grant for state-level child care programs, and a tax credit that mostly benefits middle-class families. To offset the cost of this plan, sources said that Warren will propose using revenue from her proposal for a new tax on wealth, which would be the ultramillionaires tax. I didn't have this channel started yet when that came out, but I did do I had all the notes for a full breakdown of that as well. But the ultramillionaires tax is projected to raise, from the studies that I've seen, around $275 billion a year. So $700 billion over 10 years. That comes out to about an average of $70 billion a year, and from there, $275 billion a year would obviously cover that easily, with around $205 billion left over. So that's where they're expecting to have the revenue to be able to pay for this. I think I'd also read in there that she said there would be no deficit spending for this at all, which makes sense because she would have all of these costs covered anyway with that plan. As long as the ultramillionaires tax passes, I mean, obviously that depends on who's in Congress at the time. If you have a lot of Republicans in Congress, you're never going to get an ultramillionaires tax through. But I'm thinking in 2020 it won't be majority Republicans, so we'll see where that goes as time goes on. I do like the idea of the ultramillionaires tax. For people who don't know it by its official name, that's the wealth tax that Elizabeth Warren had proposed. So onward here with more of the facts of the situation. The reason that costs are capped at 7% of income is because that's the figure that the Department of Health and Human Services uses to officially define affordable childcare. So they're basically saying, all right, we're going to keep it no matter what. Even if you are somebody that's above that 200% over the poverty line, we're still going to make sure that it still falls into the realm of what would be deemed affordable childcare. A married couple on average paid 11% of their household income on childcare, according to the Childcare Aware of America. Is that meant to be Awareness of America? I'm assuming it would be Childcare Awareness of America. While single parents paid 37% of their income. I mean, obviously, 11% is definitely too high already for households, and then 37% of single parents' incomes. That's incredibly too high. I mean, I can't even believe that any single parent could afford to even do that. So, yeah, that is definitely a legitimate issue that needs to be addressed. So, continuing on here, In California, childcare costs an average of $16,000 a year, which is 18.6% of the median income for married couples. And the reason I cited California there is because that is one of, on the spectrum, it is on the more expensive side of things. Some states are far less expensive. I think Mississippi would be an example of that in terms of how much of the median income goes towards childcare, but California was on the higher end of the spectrum, so I decided to include that just so you have an idea of where how much people are getting killed on that in the more expensive places to live in the United States. And sources said that in the new proposal, Warren will call for requiring childcare providers that receive federal funds to meet standards similar to those that currently apply to the Head Start program or the U.S. military's childcare system. The U.S. military's childcare system, and I actually did not know this, was called the best childcare system in the nation by the Hechinger report, or the Hechinger report, in 2016. The Hechinger report is an independent nonprofit newsroom that covers inequality and innovation in education. So those are some of the facts of what the plan is, what the plan wants to do, and how it plans to go about doing it. So we would basically have these federal standards in place for anybody that is receiving funds from the federal government for this child care program, and they would have to meet these standards of either the Head Start program or the U.S. military child care program. So from everything I've heard, I would much prefer that it would be the U.S. military child care program, because according to it, everything that I've seen, that's basically the best public run system for childcare that you can point to in the United States right now in terms of the standards that it sets. So I think that would be the model to hold it up to. And just so everybody knows, I'm not like a full out expert on the military's childcare program, so keep that in mind. But from everything that I've read about it leading up to this, including reading from that report, that it is a program that does a better job than most childcare programs in the United States, and publicly does the best job. So I also wanted to go statistically. I can actually get the notepad out of here now, and then I also wanted to just talk statistically about what some of the problems are with childcare. We had already addressed some of them, that it's around 11% of the median income of a household for like two-parent household, but then 37% of the median income for a single parent. But let's get into some more of the issues that are around the childcare in the United States. First off, there is no mandated maternity leave or parental leave. So that already causes a problem where people are forced to go back to work sooner. So then they have to start finding services outside of the home unless one of the parents is staying home. And they have to start paying almost immediately. They don't even have that break to even evaluate what kind of childcare is available to them and really make the best decision on it. That normally, a lot of times, you're going straight back to work, and you may not always have that kind of time to be able to evaluate what your best option is in terms of childcare. And some people can avoid that by having a parent stay home, but a lot of people do need more expendable income by having the parent go to work. So this poses a huge problem, because childcare, early childhood care, is so expensive in this country that it is limiting people's ability to go back to work and have two parents working. But then also in terms of that, they're not really able to make as much expendable income as they should be able to. So it's a problem. And here are some more statistics about what kind of a problem it really is. So this is from the New Republic. This is an article called "The Case for Universal Daycare." It came out in May of 2018. Look it up. Maybe I'll provide a link in the video description below for that as well. But it is an insightful look into early childhood care in the United States and what some of the problems are with it. So, most Americans have long considered childcare to be a personal problem rather than a collective one. But times have changed. Today, nearly 8 million families pay nannies, daycare centers, or some other provider to watch over their children, according to census data. This shift from parental to professional care has not been a happy one economically. Annual costs can easily reach tens of thousands of dollars, outpacing what families typically spend on food and, in many states, housing or even public college tuition. In Massachusetts, for example, where childcare costs are some of the highest in the country, A parent with an infant spends an average of $20,125 each year on daycare. Freshman year tuition at the University of Massachusetts Amherst runs only $14,596. So already you can see a problem there. In terms of how much the care has grown, in terms of how expensive it has grown exponentially in terms of the cost. And then, as we all know from, if you are a progressive coming to this channel or you're looking to get informed more, there has not been a wage increase since the 70s in the United States when adjusted for inflation. So, while these costs are skyrocketing, wages are not skyrocketing. So that is another problem with working families trying to be able to afford all of this early childhood care when they're not receiving the assistance that they really need. And back to the New Republic here. The expense doesn't necessarily result in good care. Fewer than 10% of daycare centers, according to a 2006 survey, have well-trained and well-educated providers who read books aloud to children, respond to them, ask questions, and encourage their development. So that is another part of the situation, that you're not even having well-trained people there. So obviously having a higher federal standard for who is being hired there is a big thing as well. There was another statistic that I wanted to pull up, that how low the wages were for childcare workers. An estimated 2 million Americans, mostly women, work in the childcare industry, taking care of 10 million young children. They earn an average hourly wage of $10.82, about one-third of what elementary school teachers make. Early care and education has largely failed to generate sufficient wages that would allow early educators to meet their basic needs, a report released last year by the University of California, Berkeley concluded. So, you're seeing how low the wages are there. The educators are barely even able to afford their basic needs. And that's going to factor into the quality of workers that you're also hiring. Not only do these people deserve to be paid more, but then you're also losing out on people that could actually be very good childcare workers that aren't taking those jobs because they could make far more money doing elementary school teaching or any kind of high school teaching as well. So you have a problem there where it's not a very lucrative industry to be in terms of the amount of money you can make working in early childhood care. So that is another thing that has to be addressed. The federal standard for the amount that is paid to these child care workers definitely has to be improved, and you have to raise that quite a bit because, I mean, I'm part of the fight for 15, so I do want a $15 living wage in the United States, so that is another problem where they're not even making close to that right now, so that has to be, and they should be making even more than just what a $15 minimum wage is, but that would be a great start. So onward we go with even more numbers here. I know I'm probably killing some people with the amount of numbers, but this is the way we're going to break it down. I want to be able to give you insight into everything that's going on with not only the details of the plan, but what the plan is trying to address and what the reality of the situation really is. So 50 years ago, this is back to the New Republic, by the way. 50 years ago, this situation would have essentially been unthinkable. In 1970, about half of all American mothers stayed at home to care for their children. But today, the vast majority of parents, men and women, want to work outside the home, yet too often they can't because they can't afford care for their children. In 2016, nearly 2 million parents with kids age 5 and younger had to quit, turn down a job, or significantly change their work because of childcare problems. Women are often the hardest hit. Since the 1980s, as childcare costs have climbed 70%, working mothers' labor force participation rate has declined 13% in that same time. So, since the 1980s, childcare costs have raised 70%. And what did I tell you? That since the 1970s, wages have not increased in this country when you adjust for inflation. So, obviously that is a gigantic problem. You have one thing inflating in costs rapidly, and then you have the people that need to be able to pay for that thing, and they're not making any more money than they were before when you adjust for inflation. So that is a gigantic problem. Obviously, that shows part of the dynamic of why the struggle has gotten worse and worse since the 1970s and the 1980s in terms of early childhood care and parents being able to both work rather than just have one stay at home with the children. So a few more numbers to get out of the way here and a few other this is more of just a stat than a number, but the United States spends less on childcare and early childhood education than all other developed countries except for Turkey, Latvia, and Croatia. So I don't think you even need me to tell you that that's obviously a problem. We obviously need to spend more on this. It needs to be something where the federal government takes a bigger role in this as well. But now we're going to get to some of the problems of what some people are calling Warren Care. But overall, Elizabeth Warren's universal child care plan could have. So there are definitely some problems that could happen. And one of the biggest problems that I would say is when you're using the federal funds to fund some of these private systems, and you also are allowing local regulation of that. So you have federal regulation in this, but somebody's calling me, so I can't even source it. But you have federal regulation where there are federal standards that have to be met. But you also have, she's also allowing a lot of local authority on what ends up happening between home care and center care. So what you end up having a problem with now is that sometimes these local governments inside of the states can actually try and sabotage these programs a little bit. We saw this happen with Obamacare, where they tried not to adapt to these federal standards at all, or tried to throw a wrench into them in certain cases, or just adapted them as slowly as physically possible, and basically made the program far less effective than it could have been because they were involved, and because a lot of the red states didn't want to adopt these programs. So they tried to slow it down as much as they could, or just grind it to a halt. In some cases, just try not to apply it at all. So that is some of the problems with having these federal standards and having the localities adopt it. So that could also be a problem. And then also the other problem with this child care proposal is that you have a situation where it is basically kind of like an Obamacare, where you're having these federal funds go towards making childcare free below a certain line. But what would be better is if you had it where it was a legitimately universal program in the same way that... So Obamacare tried to basically give everybody access to affordable care. And then that's basically what this program is doing as well. Obviously, there is a decent percentage of people that will get it for free. But then there is also that percentage of people that is paying no more than 7% of their annual income. But what's happening there is those people are going to get disgruntled, and you're going to have a similar thing in terms of the popularity of it compared to Obamacare, where Medicare for All is so popular, it polls at 70% in every poll that I see. But then you have something like Obamacare that has always been polling around 50%. A lot of times it dipped below 50%, but it's always been in that range. And the reason why is, even though Obamacare is far better than the system that we had before that, is because there are people there that get disgruntled that they're subsidizing it. And it's not just people that are billionaires and millionaires. It's people that make maybe $75,000 a year in Warren Care's proposal, where as a family of four, where now they're not getting the benefits of it. So you're having a broader swath of the population than just like the 0.001% of the American population that's going to have to pay out more for this, and they're not getting the universal coverage part of it. I mean, they are getting cost control, but that's still not going to be enough to a lot of people where they feel like they should be getting the full benefits of the program if they're paying into it. So what you really need to do is you need to make that program legitimately universal and fully federally run. So that way it's just like a Medicare for All thing, where you want to have it in that type of way. Because, for instance, another parallel to Obamacare is that Republicans will consistently attack Obamacare, and they'll want to get rid of Obamacare. And they have some area to do so, because it's always polling around 50%. So when you have something that's always around 50%, there is still a decent amount of the country that doesn't want that to be in place at all. So you can play to that, you can play to your base with that, and say that, yes, we're going to get rid of Obamacare. And even though from a left perspective, Obamacare is far better than what we had before, it is still a half measure, and it's still not even close to good enough, and it's something that has been gutted since the Trump administration has gotten into office. So, when you have something like that, you don't want to see the same thing happen with this child care plan, because this is a legitimate issue, and you want this to be something that once you institute it, it's going to be very hard for politicians to ever repeal it. You don't want it to be in danger of being repealed where half of the country kind of doesn't know where to go on it, and obviously the Republican base is going to basically oppose most of it either way, but you could still get some reasonable crossovers in there that know what the problems are with childcare and know that there needs to be a solution to it. But basically, at the end of the day, the problem that you're looking at is something that if you do the half measures where it's more of a welfare program, then it's not going to be nearly as popular with the wide population of the country as if you just went for a universal program and had it benefit everybody and help to lower costs for everybody. So I think that is the major flaw in it, is what Elizabeth Warren proposing a lot better than what we have now. 100% yes. It would be a huge improvement over the system that we have now for early childhood care. But at the same time, it doesn't do enough where it's still going to make itself vulnerable by not doing enough and still being somewhat of a half measure where it's allowing states' authority to be involved. And you don't want to have the states be overly involved in the administering of this, because you give a lot of room for them to kind of tinker with it and not adapt to the standards that you want them to adapt. So those are some of the problems with it. We went over more facts, and I can even repeat in terms of what goes on with this program. I mean, in terms of paying for it, I don't want to hear anything of how can you pay for it, because I did say how you could pay for it, and you could pay for it easily. There are multiple different ways about raising the money to be able to pay for a program like that. Something that averages out to around $70 billion a year. You can easily put a few things in place to be able to make that happen. So that's not a problem at all in terms of paying for it. But the one thing I would say is go all the way with it and make it fully universal for everybody. Don't let it become something where it's somewhat of a welfare program where Republicans will attack it and attack it and attack it as a welfare program. And their base will support that, obviously. So you don't want to have that situation happen. You're making it more vulnerable than it has to be, because this country is having a big problem with early childhood care, and the solution is to give universal childhood care. But we need to just make it universal, literally for everybody. We can't have it where it's universal childhood care, but then it's making it more affordable for a certain amount of population that then feels like they're subsidizing the rest of it. If you're doing that for billionaires and the ultra rich, then that's one thing. I'm fine with that. Like the ultra millionaires tax would be paying for all of it anyway. So I'm fine with that part of it. But then the fact that you have people still paying no more than 7% when they're above over 200% of the poverty line, then you have people that are still paying for early childhood care that are saying, well, why isn't this program benefiting me? And that is a way where holes can be poked in it by Republicans, like what happened with Obamacare. And you could even say that is part of the reason why we didn't want a public option, why when some of these Democratic candidates come out, or Democratic politicians come out and say that they want a public option, we say, no, you gotta go Medicare for all and make it universal, or else it's vulnerable and it can be attacked, and it is not going to be as popular as a universal program. Once you get that universal program in place, it is cemented in. And that's what needs to be done with universal childcare as well. And hopefully we have a proposal from one of the candidates to actually do that soon. Elizabeth Warren is the first 2020 candidate so far to have released a childcare proposal like that. So we'll see what Bernie Sanders comes out with when it comes to childcare in his platform. And there are a few other progressive candidates in there, such as Andrew Yang, such as Tulsi Gabbard. So we'll see what kind of plans they're proposing for early childhood care as well. And thanks again to everybody for watching. I know there is a lot of statistics there, a lot of numbers, a lot of details, but hey, it's a policy proposal. That's what we got to do. And hopefully you feel like you understand the program a lot more now that you watch this video than beforehand. I appreciate everybody for watching. Like I said in all of my other videos, this is just a new channel. I just started it last week, and I'm looking to go full-time with it by the week after next. So I really appreciate it if you do subscribe, like the video if you like the content, share the video if you have friends that you feel like would like the video as well. I genuinely do appreciate it. I want this channel to be for the audience. I want to be there for you. I'm going to be reading the comment sections. I'm going to be checking Twitter all the time. I'm going to be checking my notifications on YouTube, checking my email, making sure that if you need to get in contact with me to ask me anything about where I stand on something, if you want me to cover a certain topic, if you want me to go live more often, if you just have a suggestion for the show, then go right ahead and let me know, and I'll make sure I get back to you on that. That's what I want this channel to be all about. So like I said, I appreciate everybody for watching. I'd love it if you subscribed and liked the video. Hit the bell as well, so that way you're notified anytime I do release a new video. Thanks again, guys. Have a great weekend.